Welcome to Success in Chaos. We wanted to do this episode a little bit different, so you are actually going to be hearing from me and Kandice this time. We have never done this where we kind of went into our backgrounds and what we're passionate about and how we got where we are in our career and how we're driving success in chaos. So we're really excited to do this episode. So I'm Angela Adams, CEO of Inflow Health.
And I'm Kandice Garcia, CEO of Tungsten QI Partners and Quality Improvement Director for the ACR Learning Network.
So
Hey, I'm so
today,
excited.
I am too. Today we have Kandice Garcia. She's absolutely amazing, as you guys already know. One of the surprising things that I learned about you early on, Kandice, was that you started your career um, in exercise science and physiology. And I would love to know from that experience how you ended up in the healthcare side of the business.
Yeah. Well, it's like feels so long ago now, but I spent like a decade of my life in the gym. And I loved it. I loved it there so much. What amazing people. Yeah. Exercise is everything. But really, that's where I started to hone my skills of like change and leading people and setting goals and accomplishing like long term commitments to life, right? And it's complicated to change your life. There's exercise and diet and sleep and water and all the things that go into it. So I spent about, like I said, about 10 years focused, had a career in exercise, went to graduate school in exercise physiology and started working with patients. And that's when I realized, wow, there's a lot about the body and disease and taking care of people that I don't know anything about. I should go to nursing school. And so that's because clearly that's
Easy.
like the next thought there. Yeah. So I did an accelerated bachelor's in nursing and somehow ended up in radiology as a radiology nurse, which, once you're there, you don't leave. It was a great environment. I loved imaging services. I got to work across multiple modalities, primarily in IR. When I was there, I also was in CT and MRI and actually got to do a little bit in ultrasound. And so it really was this like whole new world of healthcare that I didn't, had no idea even existed. And so because I was somebody who liked to make things better, I'm a compulsive improver. And so part
I love that. A
I know,
compulsive
I
improver.
can't help it. I literally cannot help it now. And they had a part-time role in quality improvement that came up. It was the first of its kind in that department. And so I applied. They gave it to me. I didn't know what I was doing, but we were starting a lean journey at that organization. So I started doing
As soon as
Kaizen
they got your
events.
application, they were like, we've got a sucker on the line. Like, look at this girl. She's ready. She doesn't even know what she's getting herself into.
I know. I had no idea. I had no idea. I was just out there trying to solve problems, be like, come on, everybody, we can do it. But you know what? We did make some big changes. We redesigned the front desk. I did a series of like patient education videos that are somewhere archived, I'm sure. I hope I never see them again.
We need to get
Um,
our hands on those for sure.
I know. Oh my gosh. Young
Would you
me. She was so
like recording them
helpful.
on VHS back then? Just
It
kidding.
was. It was me and one producer. He sat in an office. We sat in a little closet and did these videos. It was so fun. One day my administrative director, David Sostrich, pulled me aside and he said, look,
I know
and
David.
I know he's still in radiology, still
He's
directing.
still, yeah, he's amazing. He's
He's
actually at
amazing.
Marin. Yeah, he's at Marin.
That's right. That's right. He did just
Yeah.
make a move. Yeah, shout out to David Sostrich. He was so kind. He came up to me one day and said, I know I'm going to regret this, but there is a full-time quality improvement position in radiology at Stanford. I think you should apply. And so because of him, I applied for the position and I got it. And
What a great leader.
that is why he was such a great leader, is those who can see like the potential in their staff, put them in the right position, give them the right opportunities. I'll be forever grateful for him. I mean, he does it for everybody though. It wasn't just me. He was just that kind of leader.
It's a
Um,
great leader. Yeah.
Yeah. So that's where I met Dr. David Larson, who had been recruited to Stanford from Cincinnati Children's Hospital to transform the way they did quality at Stanford. I was his quality manager, and we ended up with a team of 3 project managers. So there was a good group of us that were coming in to kind of design and facilitate Dr. Larson's vision for improvement. All of the things that we were in charge of was change, just change in the department, whether it was like
Yeah.
implementing a new product or facilitating improvement, meeting departmental goals. We were in charge of it. And so you could imagine there's a lot to do. So his vision was that if we teach our frontline staff how to participate in improvement, we can increase our problem solving capabilities exponentially.
Yeah. Get
So
everybody involved. That's amazing.
yeah, but it's not easy to do because people don't know
No.
how to do quality and it requires a really structured way of doing it. You have to have a path that everybody is walking together in order to keep them together all towards kind of a shared goal. So I guess that was about 12 years ago. The RITE program was born. That's realizing improvement through team empowerment. It's a team-based, project-based, multidisciplinary improvement program where we teach a structured process for improvement while also getting projects done. And so in our first 6-month cohort, we completed 8 major departmental projects from decreasing no-shows in MRI to increasing or improving mammography positioning. I think we did a stroke code project, decreasing the door to CT time for not pre-notified strokes. I mean, it was a wild success. We were able to accomplish a lot, and we trained all of these staff members. I think we ended up training like 50 staff members in our first cohort.
Well, that's
From
amazing. So then that was the impetus, or that was the behind the scenes of the Empower program that we know today that is
Yes,
part of the ACR. Okay. That's
yes.
interesting. I didn't know that whole part.
Well, we spread it to the entire hospital. So Stanford uses the RITE program as their method for improvement, and they're doing problem solving all over the hospital. So decreasing time for transplants, pharmacy, lab, neurology, ophthalmology. We really call it the problem solving machine because it really
That's
does
cool.
just yeah, turn out projects. And 6 years ago, we partnered with the ACR to create the national platform for improvement called the Learning Network, where organizations from across the country come to solve global problems in radiology with us through the Empower program.
Which is how
And
Candace and I met.
yeah, we
Somehow, some
have,
way, we got a hold of each other and we were solving the same challenges through inflow health. I think we wanted to comment on something that you guys had out for like guidance around incidental follow up. And I was like, I'm just going to reach out to this lady. And then the rest is history. We found our commonalities in mission, and it's been an amazing couple of, well, I guess it's been like what, 4 years now that we've known each other.
4 years now. 4 years
It's
now.
been
We've done about 85 projects through the network at organizations across the country. All the big ones: Cleveland Clinic, Mayo, D. Anderson, Stanford, URMC, and then, of course, our health systems like Advent, Ochsner. We have done small radiology groups or small community hospitals like St. Tammany, Terrebonne, Salinas Valley, radiology groups like RIMI, RMI, RAD Partners, like you name it. We have been able to help facilitate change across these organizations. And it has just been such a gift to collect all these like minded improvers who really want to make a difference.
Yeah, no, that's incredible. So then tell me what the catalyst was for you to create Tungsten QI Partners.
Yeah. So back to our compulsive problem solving is that, we saw a problem was that, hey, although we have this wonderful improvement machine that is the best way to train staff, to get projects done, to solve these massive, huge problems, like there is a bit of a barrier to entry. It's like, and I'll talk about 2 different people or 2 different types of people that we interact with that the program is not great for. It doesn't work for. It's number 1 is if you are a one person and you have hope and you have drive and you want to make things better, but your organization isn't quite there, or we call it the stars have not all aligned, meaning that your organizational goals, plus your resources, plus your leader in the area, plus the staffing, like all of those things kind of align for you to participate in a big project. If those things aren't always all together, where do you as an individual go to learn more about improvement, make things better, get support, especially quality managers or our up and coming leaders? So we have created basically the Tungsten QI improvement community, where you can come and just join us. We lovingly call it, the island of the misfit toys. It's like if you are a person who feels out of place with all of this hope and all of this possibility, like come join us. We'll help you. But there we have things like book clubs and like, fireside chats with Dr. Larson and, you know, different types of education and knowledge and community. We have discussion boards. You can ask for help. We'll do private coaching. We'll do, process mapping, just like kind of a resource place, but more of like a community. Like you are not alone. You are right to believe that there is a way forward and that there is a better future for all of our patients and our staff. And like, come join the community because that's what we're all doing there as individuals. And the second one is for our leaders. So, you know, leading in an environment of improvement is different than what we have been doing in the past. It takes a different style of leadership. It takes a different vision for the future. There is no future in improvement and change without technology integration. And we're at a place right now where we are expecting our healthcare leaders to know how to do this, to know how to select technology, how to integrate it, how to optimize it, how to redesign roles and responsibilities, how to get rid of the variability that these systems have created. I don't know about you, but that is a whole skill set in itself. And we cannot expect our leaders to do this independently. And so at Tungsten QI, we created a whole arm where we support our leaders in doing just that. Whether it's selecting technology, integrating technology, we support technology companies in supporting their organizations to meet the outcomes. Um, and or if it's just actually just doing, how do I move forward? I'm in this place, I want to do improvement, where do I even start? And so we have what we would call more traditional consulting services, where we'll come in for a bit of time and we'll partner with you in helping you get unstuck and move forward towards the vision that you know you have. Although it's not like traditional consulting. It is definitely more based on our philosophies of improvement, team-based problem solving, measure development, communication, and real achievable outcomes.
Well, that's amazing. No, I'm glad that's work that's needed. I'm glad you're out there doing it with organizations. Um, One place I wanted to go next, like a lot of leaders feel like they're constantly putting out fires. We started this podcast called Success in Chaos because we wanted to highlight people that were still driving success against the chaos. You said that you thrive in chaos. You've mentioned that on several podcasts. What is your perspective on complexity versus complicated that allows you to see a path forward when maybe some other people would feel like, oh, I'm just hitting a wall?
Yeah. I think understanding the difference, but the first step is understanding the difference between complicated, complex, and chaos. Those are different things and require us to interact with the environment in different ways. So just off the bat, I think it was Dr. Larson in our very first podcast that we ever did, really talked
Yeah,
about the
don't judge
difference.
us on that one.
Yeah.
That was our first foray.
There's so much good knowledge in that one too.
It's
Oh my
so
God,
good.
I was so nervous.
I feel
I
like
was
we were
nervous,
super
so
awkward. We
nervous.
were like, hi, my name is, yeah.
Yeah, no, it's fine. It's fine. We grow so much every time. Um, but he did touch on that, like, it is not, healthcare is not a chaotic environment. It's a complex environment. Um, but it can seem chaotic because there's a lot of things that you need to be able to understand and recognize in order to kind of like make sense of it all.
Yeah.
But the difference between complexity and complicated is that complicated is actually very much more like manufacturing, where it is lots of things coming together, but they're fairly linear, like you can kind of organize them and they're kind of like step by step. Where a complex environment like healthcare is systems and processes all coming together, and each one of those systems and processes is actually just a group of people. It's people coming together and doing these things. And so while the process or the steps can be fairly predictable on paper, it is actually people interacting with people, and that's what makes it feel chaotic or unpredictable.
Yeah,
But
no,
when
I
you
would agree.
yeah, when you understand it like that, the way that you would lead in a complex environment is different than the way you would lead in a complicated environment. And I think what we have done is we have taken a lot of very structured, very antiquated management styles, techniques, and applied them to healthcare, not understanding that the environment requires a different type of leadership.
Yeah.
Less of a dictator, more of a gardener. Um,
Which I feel like the dictator style of leadership has phased out. I mean, at most places. It used to be like, I'm the CEO and I said what I said and we're going to do it my way. Now you see a lot of upper management leadership, C suite, that's like, no, I want to bring my team along. I want this to be, everybody is in this. I want everybody to feel ownership of this mission. And so I do see that, especially post COVID. I feel like that helped a lot of health systems to go through that, though it was a really difficult time. Almost every person that has come on the podcast has pointed back to that time period and said, man, we learned so much about how to lead, team cohesion. Like
yeah,
it broke down everything, right? Because everything
yeah,
that we knew in healthcare kind of like just collapsed overnight and we had to rethink. And so I think every single guest has brought up that time period of like, man, this was transformative for our teams and that they came out of it in a better place after going through all of that. In your work, you focus heavily on this dual empowerment idea. How do you manage when you have frontline staff, very different than leading executive leadership? You have to get them both like headed in the same direction. Tell me how you get both aligned and engaged in your projects with Tungsten.
yeah. Well, it's the way I like to describe it is like the frontline staff is our knowledge. They're the ones who actually know, right? So when you're not working the process, you don't actually know what's going on. You have an idea, you have a theory, but you don't live the day to day. You don't know the actual small nuanced problems that arise or challenges or workarounds. And so we call our frontline staff kind of like the knowledge and where they see the problems. And then you have this upper level in the org chart, upper level leadership who are responsible for the process. They're responsible for supporting the process and they're responsible for the outcomes of the process. And so they have to make decisions about what's happening. They have to provide resources. They have to do these things, but they don't actually know what is needed. And so when we're actually going to change an environment, you have to not only bring those two people or those two levels of leadership or participation in the organization together so that everybody participates in improvement from where we stand. But improvement doesn't just happen at the front line, it also happens at the management of the process or the leadership of the process. And actually, a lot of the improvement is done about the structures that support the process, not just the process itself. And so it requires this dual empowerment or dual dimensional improvement that these projects will do. That's why improvement is so hard, is because it's not just here that you're improving all of this. So, for example, when we're doing, let's say, prostate MR image quality, want to improve the quality of our prostate MRs, very important exam, very important for them to be good. You may get on the front line and be working with the staff, and they're like, the technologist continues to select the wrong protocol. I think on the surface, the problem solving is create a guide so that everybody knows which protocol to select and have them do it, right? But if you take 3 steps back, you realize actually the protocols vary across scanner. We don't use the same naming convention on all scanners. We don't
Interesting.
alert our technologists to when the protocols have been changed. And so the solution is actually maybe creating a role and responsibility in your department of somebody who's supposed to manage protocols. Or maybe it's investing in a technology that shares protocols across your fleet. So those are systemic changes. Those are systematic changes that need to happen at the leadership level, but they can only be understood at the front line.
Yeah,
And
no, that makes
so,
sense. Because it seems like such a simple thing, like, "Oh, well, why are they choosing the wrong protocol?" That seems like a simple thing, but, like, when you really break into it, it's got all of these complexities, so you have to bring those teams together.
yeah,
Um, that's pretty
it's
interesting.
and all problems are like that. They're complex and multidimensional and deep. They go deep.
Yeah.
I
Let's
improve.
talk about AI.
No. Yay.
Um, so much, I would say energy, curiosity, anxiety around AI in healthcare right now, and even thinking about, like, we hear the headlines all the time, which I'm so sick of it. I'm so sick of hearing AI to replace radiology, like, can we stop with this? But, um, tell me your thoughts on, human roles versus AI, human in the loop, or do you argue that AI elevates the staff, replaces the staff? Like, where is your head on technology, even applications to radiology, which is the most advanced in these specialties for AI around healthcare? Um, tell me what your thoughts are.
Yeah. Well, I mean, first, like, what a time we're living in. This is,
What a time.
this is in history. I can't wait to look back on all this and be like, what were we doing? What did we just do? And so I think that a lot of the fear comes with the unknown about where this is going and how it's going to work. And honestly, I share those fears. I really do. I think we have to be cautiously optimistic about how we move into this space. But, working with leaders to select and implement technology, working with frontline staff to kind of actually optimize the technology that they have, I get to see, you know, how this is playing out in a lot of different arenas. And, one of the things that we have to acknowledge in healthcare, which may be different than other industries, is that we are not surviving as an industry. Like, we are in crisis mode. Like, there are not enough staff members, there are not enough people to do the work. It is very painful for our patients to participate with us. It's very painful for our staff to be part of it. I know, a lot of our staff members say that, I live in my life in this kind of like technology age. And then I walk into the hospital and I feel like I'm going back in 15 years.
Yeah.
And, the technology is just not there. So I think number one is that this is a great solution for us as an industry because the cavalry is not coming. There isn't 1,000 technologists just waiting for us to like hire them. They're not coming. The staffing shortage is not ending. The budget crisis is not ending, and we have to find an alternative solution. And so AI is a great solution in theory. So, how this gets implemented, the strategy you use, what you use AI for, how you use it in your organization, and then how you redesign your organization around the AI is what is actually going to make the biggest difference for you. Obviously, selecting the right companies, the right people. AI is not just about the technology. It's a long-term relationship with the companies. I
Yeah.
cannot stress this enough because implementing is just day one. It's, on how we're going to work together and make this work as a team. But there are opportunities for staff. And I would always say if somebody's looking to implement AI, start with the things that AI does really well, which is organize information, maybe find information. Data. Oh my goodness. There is so much information within the system that we are having such a hard time pulling out. And this like world of AI agents and kind of just access to information is opening up to us. And so there's actually a lot of things that you could or should be doing that you're not doing because you don't have the ability to do it. And AI will be able to fill that gap, as well as decrease variability in the things that are fairly like standardized, like uh, reminder calls. um, like
Yeah.
billing, authorization. People are spending their time doing this where AI could really do these things, but
Yeah, the
AI
repetitive
doesn't work.
tasks. It's amazing to me how many repetitive tasks, like, are extremely educated, knowledgeable, experienced nurses and case managers and even physicians are still doing a lot of this repetitive work. That's, like, a prime example of where AI can immediately offer value.
Information organization. I just was at a hospital and they had two full-time staff managing a spreadsheet to organize information. They were like going in and updating it every day, changing it. And I was like, oh my gosh, this is a great opportunity right here. So I think that, as Nina Kotler and Dr. Larson say, um, you know, AI is not going to be replace radiologists, but radiologists who use AI will replace those who don't. And I think
Yeah.
that's the true for all healthcare workers. That's true for all organizations. So the strategy, the effectiveness of the implementation, and the integration of your staff with AI actually is the way forward. And that's what we really try to help to do is to see that this can be done in a way that supports your staff, doesn't replace them, and supports your operations to elevate you not only above your competitors, but in service of your patients, which is the ultimate goal.
Yeah, absolutely. Well, this was amazing. I'm glad we got to spend this time talking. You're
I
doing amazing
know.
work out there with
Thank
all of
you.
these amazing healthcare systems, leaders, and frontline staff. So, thank you for your contribution. We always end with the same thing. So, what are you reading? What's influencing you right now? Anything that you can give the audience?
I mean, this is not just decorative, although it is beautiful with all the colors. But we're obsessively reading about improvement. I think one thing that our program and our methods do really well is it's not just lean, it's not just Six Sigma, it's not just model for improvement. It's really the amalgamation of all of these ideas when it comes to change, data, people, process. We take it all together, we take it all in. And if I had to say there's like I'm going to limit it to four. My four major foundational books that I tend to recommend all the time are Multipliers,
Mm,
Team
good
of
one.
Teams, yes, Humble Inquiry,
Love it.
and then Creativity Inc. I would say those are my top
Nice.
four.
I don't think
Yeah,
I've read
it's
Creativity Inc., but all the other ones,
oh,
yeah, I love
so
Multipliers.
good.
It's a
Yeah,
great book. Yeah,
yeah.
that's amazing. Well, thank you. Thank you, audience, for listening in today. You wanna do our closeout?
Yeah. Um, put on my notes up. Thank you for joining us today on Success in Chaos. You can like, follow, and share wherever you get your podcasts. And thank you to Info Health for your production support. It was so fun today.
Thank
Bye,
you,
everyone.
Candace. Bye, guys.